Hi and welcome. Today we will go in depth of the best treatment methods for epilepsy so that you get the best control over your seizures and get this controlled for good. I am Dr. Omar Danoun, an epilepsy specialized neurologist, and we'll go over all of these in details. And let's start knowing where are you joining us today from. So we'd like to have everyone joining us, and thanks for everyone who tunes in. So we'll go over all the appropriate treatments and explain the triangular method for epilepsy treatment and how to get the best control over it. And we will go over these in details. And so the treatment methods that I will discuss today, it's called the triangular method because it has three angles. That's why it's called the triangular method of controlling epilepsy. This method is in particular, I created so that we have organization of thoughts and know how to tackle epilepsy completely so you can be seizure-free. The first step in this is to know the diagnosis of epilepsy, the correct diagnosis. So the most important thing is to know the correct diagnosis of epilepsy. Epilepsy diagnosis can be a little tricky. So with the diagnosis, it can be different from one patient to another, and how we get to the right diagnosis. And so welcome we asked like, where are you joining us today from? And we have Chester, Michigan. Welcome in Michigan. So I live too in Michigan, so you're welcome. Thank you so much. God bless you too. I'm really grateful to help everyone with epilepsy. So starting with the method, we will talk about the correct diagnosis. So the correct diagnosis is very, very essential because it's starting with the clinical evaluation of the patient. So the most important thing is that you be evaluated by a neurologist specialized in seizures and epilepsy. And that can be very, very important because the symptoms, what happens during the seizure is that this is the most important thing in diagnosis epilepsy of seizures or not a seizure or something mimicking or looking like a seizure. And the other thing is that which type of epilepsy we have, that also depends on the diagnosis. And the best thing you can do is to take a video of anyone who's having a seizure, like the one who's having seizures cannot do it. But if you do have anyone with seizures, take a video of them, bring it to the neurologist. That helps a lot in the diagnosis. We have also Warren, Michigan. So, welcome everyone here in Michigan. Carissa, Doctor, thank you so much. Montreal, Canada, excellent. Thank you so much. Welcome from Canada. Have lots of Canadian patients. Treatment, secondary generalized seizures. We'll talk all about that. The second angle of that is the correct treatment. The correct treatment is very, 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 very important. There are multiple types of here. First of all is the correct medication for the type of epilepsy. There are two types of epilepsy, as we will talk a little bit now. We have some focal epilepsy when seizure starts from one spot in the brain. There's a generalized epilepsy when seizures coming from all over the brain. The treatment can be different. Focal epilepsy medications cannot be given to generalized epilepsy medication, and in fact can get it worse. So the choice of medication is so important. And the second thing is that the medication, we should choose a medicine that can be given without side effects. So, for example, some medication like Keppra, levetiracetam, it's very common. People use it all the time, and that medication can have some, very bad side effects on the psychiatric, side effects, psychological. So it will have anxiety, depression, anger, mood changes. So it's very, very, very important to recognize that. And then the other thing is to do the third thing is the correct dose and correct treatment duration. The correct dose is very, very important because people can give epilepsy treatment, but they will give it in small doses. I have noticed that in lots of consultation I do worldwide that people give not enough doses. They will give low doses, and that can be a major issue why seizures are not good controlled. So you need to push the dose high enough to be able to control the seizures, and we don't want to push it too high to cause side effects. So it's always a balance. We strike a balance between having enough medicine to control the seizures, at the same time not having too much medicine that cause side effects. And in the same note, that's why we have to choose the right medicine for every patient, so that we don't run into these side effects that will stop us from or prevent us from going high in the treatment dose. And the second thing is the treatment duration. Very, very important to know that epilepsy is a chronic condition. There is lots of treatment and there are lots of treatments for epilepsy. There is so far no cure for epilepsy, but there are lots of successful treatment that you can take and control seizures. One major mistake I see here is that people do not give treatment long enough. There is a misconception about a treatment of epilepsy to be only for 2 years. This is wrong. This is a mistake. Treatment of epilepsy is not 2 years. It is long-term. And most people will need lifelong or long-term treatment for epilepsy. For example, the only time that epilepsy treatment can be 2 years if the seizures start early in life, age about 2 to 4 years, 4 to 6 years. Between 4 years and 6 years, the brain is developing, and then we have benign epilepsy like absence epilepsy, or benign Rolandic epilepsy, or Paniatopolis syndrome. These syndromes will go away as the child progresses in life. So 2 years of no seizures, we can consider stopping the medications, and that can be in children. But overall, in adults, especially if the seizure starts after age 12 and above, usually the cause is permanent, and then we need to take long-term treatment. So that's very, 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 very important to know exactly that, how to take this medication correctly. So I'm glad to cut you live. Me too. I'm glad that everyone is here. Bosnia and Herzegovina. That's very good. Welcome from Bosnia. In Canada, welcome, and from Canada. And then we have other questions. Please ask your questions. I will collect them all in the question and answer section for that. So let's talk a little bit in specific details about the best medication for epilepsy. So it's very, very important, because we're talking about treatment of epilepsy, to choose the best medication. So we have about 32 medications for epilepsy currently. And how we choose one medication for the patient, actually there is an art to that. And the more the doctor know about the medications and how to use them, the better we will be able to choose the medicine for the patient. So for example, when I see patients in consultations worldwide or in my clinic, I never give 2 patients the same medicine, because every patient has different background. So here's some tips about treatment. If the patient does have, for example, focal epilepsy, which any medication can work. If the patient has psychiatric history, which means has depression, anxiety, mood changes, anger, or even a family history of psychiatric conditions, mom has depression or any family history, we should avoid Keppra, levetiracetam, because that medicine can cause psychiatric side effects and can cause issues with the mood. Other medications that can be positive in this situation is lamotrigine or carbamazepine, Lamictal or Tegretol. They can be positive on the mood. They help with the mood. They're antidepressant and anti-anxiety medications. So it helps seizures and help the mood. For example, valproic acid, Depakote, is very good on the mood and positive, but it causes lots of side effects. It can cause weight gain and issues. So we will talk about medications in details, but we kind of have some consideration. If a woman of childbearing age, we try to not give any medication that is not safe in pregnancy, and so on. So choosing the right medication will be very, 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 very important. And I will go on medications in details today in this video, so that you know exactly how every medication works and what are the small few properties of every medication, so that we can choose the right medicine for the patient. So for us, the most essential thing is to know what type of epilepsy and where the seizures are coming from. And to do that, we talked about the clinical evaluation and history and physical exam. We do detailed analysis of what happened, how did the seizure start, started out of sleep or not. And then the second thing we do, a testing, which is the EEG. So EEG is called electroencephalogram. It's an essential test for evaluation of epilepsy patients. We put wires and electrodes on the head, and that will record the brain activity. And then we will know multiple information about that. The first thing is that we can do routine EEG about half an hour, and best to have a patient sleep during the EEG, because sometimes the EEG will be normal during wakefulness, and once the patient goes to sleep, the electricity will appear and then it will be abnormal. So it is best to have EEG during sleep, and the chances increases to capture something abnormal when the patient sleeps. So that's very, very important, sleep during the EEG. Then the second thing is that we have to do, if the first EEG is normal, we can do repeat an EEG or do it longer time, 6 hours or 24 hours or longer. So it's very, very important. The chances of EEG be positive about 15 to 30%, the routine one. So not very high chances. If we repeat it to a longer time, it can reach to 50 to 70% if we do like 24 hours EEG. So it is normal. It can happen that people who have epilepsy and the EEG is normal, and that should not rule out the possibility of epilepsy, because if it is positive, it helps. If it's negative, cannot rule it out, because it can be a small source or deep source that is beyond the EEG resolution. It's very, very important to know like what time the EEG is done. So best to do it with sleep. The second consideration of EEG is who reads the EEG and what their experience is. So it's very, very important. It can be like a little bit politically incorrect to ask your doctors that what your experience in reading EEG, but that's a major issue. In the United States and worldwide, the people who are highly experienced in EEG are a fraction of the neurologists, only like, maybe 5, 10%, 20%. That's it. Because most of the training programs do not teach people to read EEG in depth. They do 1 month or 2 months. But for you to be a confident in EEG, you need to do like a whole year fellowship, which I am running right now. I run the fellowship for epilepsy and EEG. I train people to be an epilepsy doctors. But with this long training, you can read the EEG confidently. But the problem is that with EEG, there are sometimes normal variants, things that they are normal, but they look kind of scary looking to the doctor, like look abnormal, but they are normal variants, and it's very, very similar to the epileptic activity, but they are normal. So telling them apart can be an issue, and it can be leading to wrong reading of the EEG. The second test that we like to do is the brain MRI. So we like to take pictures of the head to see if there is any obvious cause of epilepsy and seizures. And there are some words about the brain MRI. The first one is that the brain MRI should be an epilepsy protocol MRI, which is not the regular MRI. So regular MRI will take regular cuts and sequences, but in epilepsy protocol MRI, it has special cuts, thin cuts through the temporal lobe, and some high definition 3D rendering of the images. So these are more advanced slices and advanced protocols that help to differentiate the brain much, much better and look at it. And that can be higher chances of having positive brain MRI. So we need to have a good MRI itself, and we need to have a good doctor who reads MRI, because people who are, the doctors who read the MRI can be brain and neurologists who are specialized in neuroradiologists. We call them neuro-brain radiologists. And then they are experienced in brain MRI. So if it is read by these doctors, the chances of the MRI being normal, or seeing abnormalities is higher. Of course, all of it is in the focal epilepsy. In generalized epilepsy, the MRI will be normal by definition. And the chances of MRI being positive is about 30 to 45%, maximum 50%. So yes, you can have epilepsy with normal brain MRI. Other testing we like to do is genetic testing. So genetic testing is very, very important, because when you do the analysis of the genes, it can see some changes, especially if we have a syndrome of epilepsy, generalized epilepsy, or in epilepsy with children with other abnormalities in the brain, we can do it. But most of the time, the genetic testing is still in its infancy, means like it is still not a very mature science, and we need lots of more data and more advancement to be able to do it. So mostly is helpful in children, not many in adults. And the second thing I would like to discuss is the causes of epilepsy. There are multiple causes of epilepsy, and it changes with age a lot. So the first 6 years of life, from birth till year 6, most of the causes are perinatal asphyxia, like issues with birth, infections, or stroke, or changes in the brain, or genetic causes. Genetics are very big in pediatrics and children and babies, because all of these changes that happens really right after birth, and then the seizures will be part of that syndrome. And then there is a flat line of, epilepsy can happen to anyone at any age, but there is a flat line of epilepsy. And then there is a huge peak at later in life after age 65. And the most common causes of that time is scars in the brain, which is stroke, brain tumors, and traumatic brain injuries. All of these can cause scarring in the brain and can lead to seizures. So for that, we kind of transition to types of epilepsy. We have different types of epilepsy. One of them is called focal epilepsy. Focal epilepsy is when seizures happen from one part of the brain. Usually the area of the brain, whatever function there is in that area, will be exaggerated, and then it's kind of like turning on the switch. and the symptoms will be from that area. For example, if it was movement area, you'll have jerking. If it was from a memory area, you'll have deja vu, you'll have fear, all of that. So this is called focal epilepsy. This type, EEG will show focal changes in one area. MRI might show some changes in the brain. And this type, any medication can treat it. The other type is called generalized epilepsy, when seizures happen because usually a genetic cause. The electricity flow in the brain is controlled by lots of receptors and channels, and that can be defected and by a mutation, and that can cause generalized epilepsy. So it's very, very important to know if you have generalized or focal epilepsy, because medications can be completely different. So focal epilepsy, when seizures are happening only in one area, generalized all over the brain. And if you give focal epilepsy treatment to generalized epilepsy, can make things worse. Example of that, not one example, just like one of the examples, carbamazepine, Tegretol. This is good for focal epilepsy, but does not treat generalized epilepsy. In a matter of fact, it can make generalized epilepsy worse. So it is very, very, very important to do that. So it's very, very nuisance, and there are lots of consideration about what is the best treatment, how we can control of it. So because of that, I created this education consultation. I want to help you directly myself by doing one-on-one consultation. We can sit down for 1 hour over video, and we can go all over and then give you a whole treatment plan, give you the best diagnosis and treatment possible for your case. And you can go online and just book up your appointment today. It's available in the description of this video. You can just click the link, go there. You can book your own appointment today, and then I'll be seeing you via video. So you can do that all the time. It is for people who are outside the United States. Unfortunately, in the United States, due to laws and regulations, you have to come to my clinic, which is in Michigan. So you can do that. Welcome. You can call the clinic and then come in and be seen. So I will talk about every single medication right now to give you some ideas about every medication, to know the main treatment benefits, some side effects, and so on. So the first medicine I will talk about is levetiracetam. It comes under the multiple brand names, so many of them. Keppra is the most common one, Epilim, Epitam, there's so many other ones. So this medicine is working for both generalized and focal epilepsy. It's a broad spectrum, so works for any type. The good thing is about this medication is that it's given IV by a vein, so most people start in the emergency department. Overall, it does not interact with other medications. It is safe on the liver, safe on the kidney. So that's why it's an easy-to-use medication. It's a low-hanging fruit. That's why every single patient with epilepsy or like seizures in the emergency or seeing the doctors, they will give them Keppra. It's a kind of knee-jerk reaction. But the problem with Keppra is that it is psychotoxic, I call it. Psychotoxic. It causes toxicity on the psyche, which causes lots of psychiatric side effects, causes depression, anger, mood changes. The patients become angry and irritable. So Keppra is not a benign medication in terms of that. If you have any history of, like any psychiatric history, depression, anxiety, mood changes, or even if you have family history of psychiatric disorders, your mom or dad or anyone in the family has psychiatric disorders, depression, anxiety, you might have that. So it is better to avoid it. It is safe in pregnancy. It's one of the safest medications in pregnancy. We should give it in higher doses to make sure that the treatment is effective. We start with 500 milligram twice a day and go up to 1,500 milligram twice a day. So this is in general levetiracetam or Keppra. The second medication is called lamotrigine or Lamictal. Lamictal, it's one of the best medications for epilepsy. Positive things are it is given orally, but does not have IV. Can be a limitation as well. So it's given orally. It is safe on the kidney, safe on the liver. Does not have any major side effects. It's positive on the mood. Can cause stomach upset, tiredness, headache. These things normally with any anti-seizure medication, but it will resolve with time. We need to give this medication slowly. Start 25 milligram once a day and then increase slowly until we reach 100 twice a day over 7 weeks. And the reason behind that is that we want to avoid this rare side effect, but can be serious, which is Stevens-Johnson syndrome, a drug rash and allergic reaction. So this is something that we always consider when we give Lamictal, lamotrigine. It does have some interactions with medication itself, does not interact with others, but others affect it. So it can be lowered by other medication like carbamazepine, or increased in the blood by other medication like valproic acid, Debacol. So these are some interactions. Considered one of the safest medications in pregnancy as well. So it's overall a good medication that is very desirable. I see some questions. Definitely, I will be more than happy to answer them at the end of this stream video. Valproic acid, Debacine. This medication is one of the strongest medications for epilepsy. It is very, very effective in treatment of epilepsy and seizures. It's a broad spectrum. It treats focal epilepsy and generalized epilepsy. It is very, very effective. However, it has lots of side effects. It's one of the most medications that cause side effects. It's positive in the mood. Side effects can be weight gain. Can be cause some liver toxicity. We always have to monitor the liver and the blood as well. It can cause blood toxicity, liver toxicity. It can cause bleeding disorder, like bleeding faster or bruises. It can cause some issues with fertility in women, especially. It can cause polycystic ovarian syndrome and issues with fertility. And it is not safe in pregnancy at all. So we try to avoid it in any woman of childbearing age. So this medicine, it can be available IV and oral, but these are the interaction, and does interact with other medications. Other medication is carbamazepine, or brand name Tegretol. This medication is one of the older medications, and it is widely used. And it works for focal epilepsy only. If Tegretol is given to generalized epilepsy, it can make things worse. So it's very, very important to know that focal epilepsy, it helps with treatment with that, but for generalized epilepsy, it can make things worse. So it's only given for focal epilepsy. And then the carbamazepine Tegretol, it does have interaction with other medications, which can lower the other medications in the blood, because it makes the liver process medication faster, so it will lower the levels of other medications. It also can have some side effects on the kidneys, mostly in the liver and the blood, and it can lower the sodium level. So you have to always check that. Check sodium, check liver function, check blood with carbamazepine, and it can be positive in the mood, so that's a positive thing, and it's only available orally. Other medication is lacosamide, Vimpat. So lacosamide is one of the good medications. It's a broad spectrum used to treat focal epilepsy and generalized epilepsy. It's overall very well tolerated. Most common side effect is having issues with dizziness. So that's the most common side effects, but overall it's good. Some side effects are on the heart conduction. It can cause PR, interval prolongation, which is a little bit slowness in the heart rate, but overall it is safe. This is the only thing that we worry about in the heart. And overall, it does not interact with other medications available IV and oral. Pregnancy-wise, we don't know lots of information about this medication, but so far the initial information are positive. Phenobarbital, or Gardinal, or under other brands. So phenobarbital, Luminal as well in America, we call it. So phenobarbital, it's one of the oldest medications, been there for more than 100 years. This medication is mostly treat focal epilepsy. It is given very limited time right now, unless somebody had it from before. We don't give it newly for patients with epilepsy. It causes dependence and tolerance, which means that you have to increase the dose with time. It does have some interaction with other medications. It is not safe in pregnancy a lot, and it does have some liver side effects. So it's a heavy medication, very sticky. It's hard to take out. We give it mostly right now for babies who have status epilepticus as a neonate. It's a common medication that's given there. Oxcarbazepine trileptal. This is also the second generation of carbamazepine Tegretol. I have a whole video about this medication. I have videos about all of the medications for epilepsy. You can go in depth about them. But so this medication, trileptal carbamazepine, oxcarbazepine, it helps to control seizures. It works on focal epilepsy only. It can worsen generalized epilepsy, like the parent drug carbamazepine. In pregnancy, it is safer in pregnancy, one of the safer medications for pregnancy, and it's only available orally. It's not available IV, and also it can lower the sodium. It can affect the liver and the interaction with other medications. So these are the most common things. Other medication, which is really one of the best medications for epilepsy that is underrated, is called zonisamide, or Zonogram. So zonisamide has lots of very good positive things. First of all, it is a medicine that's given once a day. So it's a long-acting given once a day. And it's very helpful. It helps both focal epilepsy and generalized epilepsy. It does have a side effect of weight loss, which most people love. It can cause weight loss. And it does have other positive effects on the body. It can decrease sweating. So if you are on a hot day, especially kids, you drink water and make sure that you're covered well. So that's an important thing. It can cause kidney stones. So that's an important issue. You drink lots of water to prevent kidney stones, and it can decrease the intracranial pressure in the head. So it helps people who have issues with the brain pressure and headache because of that. So overall, it's a very good medication. It's once a day, and it's very good. One of the important things about this medication is that it is positive effect on preventing alcohol. So it does help people stop alcohol drinking. And if somebody have issues with alcohol, we know alcohol can cause seizures to happen and exacerbate epilepsy. We advise people to stop drinking alcohol. This medication is very positive in alcohol. So if somebody has alcohol disorders, we give them zonisamide. It works very well. So let's talk about the medication topiramate. So medication topiramate or Topomax, it's one of the medications for epilepsy. It is a broad spectrum, so it can treat focal epilepsy and generalized epilepsy the same. So it's a positive from that standpoint. It does also treat migraine headache, so it can treat epilepsy and migraine headaches the same. So that's a good positive features. And it's also a mood stabilizer. So these are good things. The other issues with topiramate, there are multiple ones. So first of all, it's not safe in pregnancy, so we try to avoid it in women of childbearing age. It can cause weight loss. It can cause thinking problems and cognitive issues. Some people call it Dopamax because of that thinking and issues with the brain. And it can cause kidney stones, and it can cause angle closure glaucoma. So if somebody has glaucoma in their eyes, you should not take topiramate. So all of these things can be features of topiramate. It's not only available orally. Other medications are perampanel or Fycompa. So perampanel and Fycompa are medications that are helpful for epilepsy. It is considered broad spectrum, treats focal and generalized epilepsy, and it is overall an effective medication. However, it does have bad psychiatric side effects because AMPA receptors are one of the glutamate system, and glutamate system is very strongly associated with psychiatric disorders. So because of that, perampanel has lots of psychiatric side effects, and it does have, like in the clinical trials, interestingly, people had not just suicidal ideation, they had homicidal ideation, like they're thinking about killing others, not just like themselves. So it can be an issue with that. But overall, this medicine is effective, and we found that in details that low doses like 2 milligrams to 4 milligrams works good for the patient and does not cause psychiatric side effects. And then after that, 6 milligrams and above to 12, that can cause psychiatric side effects. So we try to kind of manage that. If somebody has psychiatric issues, then we should avoid it. Other medications can be clobazam or Onfi, and in Canada and the rest of the world, it's called Frisium. This medication can be effective in epilepsy, especially Lennox-Gastaut syndromes and these other types of epilepsy. It's one of the benzodiazepines tranquilizer medications, and it is given for that, and it can be given for focal epilepsy, and it is given for catamenial epilepsy when seizures happen during the menstrual period. We can give it like 5 days around the menstrual cycle, and that can be very helpful. So it can be given in these. It can have sleepiness, tiredness, mostly side effects. Also, it can cause dizziness, and also it does interact with other medications. It can cause liver side effects. So we have to kind of monitor the liver on that. And one of the issues is tolerance and dependence, which means that we have to increase the dose with time. Other medications are ethosuximide or Zorantin. This is one of the specific medications for types of epilepsy. This medication is given for absence epilepsy, the staring spells and absence seizures in children with childhood absence or juvenile absence epilepsy. It only works on absence epilepsy and does not help with generalized tonic-clonic seizures. Most common side effects are just stomach upset. It's heavy on the stomach and GI. Most kids get used to it, especially if they take it with the meal. CBD and Epidiolex. So CBD, medical marijuana, it's a big talk on epilepsy, especially like 10 years ago when Sanjay Gupta used to do all of these, like all of these talks about the medications. But overall, CBD is a medication that is given for epilepsy. CBD is positive on epilepsy. It helps seizures. THC usually it can worsen seizures. So if you want to get CBD specific for epilepsy, you have to have it a little bit specific CBD only. And now we have pharmaceutical grade marijuana, which is called Epidiolex. That's 99% CBD. Overall, it's not one of the best medications. It's mediocre in terms of efficacy. It can cause some side effects on the stomach because it's cut with sesame oil, and GI side effects are stomach upset, diarrhea, vomiting. It can be very strong on the children, especially. It is not safe on the liver, like it can cause liver side effects. You need to kind of monitor the liver, and it does have some sedation and other interactions. The best medication ever is cenobamate so far. So cenobamate, or a new medication called Xcopri, and this is one of the best medications so far we have for epilepsy. It was approved in 2019 November, and then after that, it was not widely used because it's oral and has some interactions and has during the clinical trials allergic reaction. But I did not use it at the beginning. But when I went to conferences and I saw other people using it, found that it's super effective and very good medication for epilepsy. So I started using it and have more than 120 patients on it. And I did honestly cancel some surgeries because of cenobamate. So now we have changed the way we approach seizures and epilepsy. We first give them cenobamate, and if they do not improve in cenobamate, then we go to surgery. So this medicine is super effective. It does need slow titration. We start 12 and a half for 2 weeks, and then 25 milligram daily for 2 weeks, and then 50 milligram daily for 2 weeks, and then 100, and up to the maximum dose is 400 milligrams. It does need this slow titration. Also, it does need some monitoring on the liver and blood functions. And these are important things to consider. And it does need it does have interaction with other medications. So if the patient is on Vimpat, for example, lacosamide, or Onfi, or phenytoin, they can increase their levels in the blood and can cause some side effects increase. But we can manage that very easily. We can just lower these medications and it will be good. So this medication is very effective, very promising for epilepsy. I have very good success. So definitely consider talking to your doctor about this medication. I have many patients on it with very good success. So there are lots of considerations for epilepsy. Sometimes the epilepsy can be called drug-resistant epilepsy, which means that it's a third of patients, they have about all the medications will not help them, about 2 or more medications do not improve the seizures, then it's called drug-resistant epilepsy and can need more treatments, and these patients will do well with surgical treatment. All right, now to my favorite part, which is the questions and answers. And you guys did well. We have lots of questions. So we'll start. If you can if you can tell me a little bit, the shorter the question, the better will be. So let's start. Zainab asked treatment of secondary generalized epilepsy. So secondary generalized seizures it means that the patient has focal epilepsy but goes all over the body afterwards. So this is a treatment the same as we treat for the focal epilepsy. All the medication should work. And if one medication does not work, we should switch to another. And if 2 medications do not work, or 3, then we go to drug-resistant epilepsy pathway, which can be needing surgery. All right. Kansha is asking, I have juvenile myoclonic epilepsy. I'm a female. I got the age 17, and now I'm 36. I've been sodium valproate 7 mg daily, too much. Side effects. Do you have permanent solutions? Yes. So that's an important thing. If somebody has juvenile myoclonic epilepsy, this medication, this condition overall, it's a chronic condition. It's going to be there for life because the brain matured and they had the epilepsy afterwards, and it's a genetic, so it's built in every single cell. We have about 7-8 medications that we explained in the video about juvenile myoclonic epilepsy. So you can watch that video, and has all the treatment. There are multiple replacements for valproic acid, Depakote, and because it has lots of side effects, especially for women, so it's better to switch to other medication if you're having too many side effects. Was recently diagnosed with epilepsy, Grace, and at 20. Your videos have been very helpful to understand condition. Thank you so much, Grace, and it's really glad to hear that. All right, so hello, 35 year here, recently full seizures, possible epilepsy, had absent seizures as a child, still figuring it out, on zonisamide nightly currently. Excellent. So probably the diagnosis can be epilepsy that is about, likely a generalized epilepsy, because absence epilepsy as a child, and then it matured as adult with generalized tonic-clonic seizures. So that's an important thing to consider. So likely it's absence epilepsy. Zonisamide is good because it can treat focal epilepsy and generalized epilepsy. We need to push the doses higher. I have a video on zonisamide that gives you exactly what doses, but we need to go like about 300 milligram until we say like, yes, things are good. And all right, so excellent. So so this is very important. And thank you so much, Kevin, for the super sticker. I appreciate that. Appreciate your support and everything. So definitely keep asking questions. I'll keep going over them. From Pakistan, welcome everyone. And it's nighttime in Pakistan. I know it's almost midnight. So is Brevissure 50 a good medicine for epilepsy? If you can, whenever you ask a question about medication, if you can mention the brand name, just also the generic of the medicine. For example, Brevishur, likely it is a Breviact or Breviracetam. So just say that, so that it helps me to know exactly, because there are some change, like local brands that I don't know. But Breviracetam, yes, it's a good medication. It's the second generation of levetiracetam or Keppra, and it is safe medication, and it does have less psychiatric side effects than Keppra. So it's a good medication. There is a whole video about that medication. Chester, UK, excellent, brilliant. Thank you so much. Temporal lobe epilepsy, any info on this? Yes, I have a whole video about temporal lobe epilepsy that goes in details about the causes, diagnosis, treatment. But it's one of the focal epilepsy, so all medications should work. If medications do not control it, we have surgeries that can help. Genes, my twin has epilepsy as well. Brothers later in life, yes, it can be. So when twins have epilepsy, it might be a genetic cause. So having a genetic testing might be very helpful. So Arif Khan, it says, my son has diagnosed with JME, juvenile myoclonic epilepsy. After one seizure, following myoclonic jerks for 6 months, seizure-free approaching 1 year, is taking Keppra 750 ER in 1 day, slow down, looking to wean. Thoughts? Excellent. So thank you. So I try to not, give I cannot give medical advice in this channel. I just give you information about epilepsy, and I need to know the case in depth. But this information is just in general. It's not medical advice for you. But saying that if somebody has juvenile myoclonic epilepsy, this diagnosis is lifelong. The diagnosis of juvenile myoclonic epilepsy happens juvenile age after age 12, and then there are changes in the brain that is genetic. It's built in every single cell of the brain. So the brain is designed and built to have seizures and excess electricity. Medications will calm down the electricity and stop the seizures. But the minute you take out the medications, there is a huge chance seizures will come back. And about 90% of the time, patients will need medications. So if you stop the medications, about 90% seizures will come back. So honestly, do not stop medications, juvenile myoclonic epilepsy at all. Amy, I had my first seizure when I was 25. Was in the day. I did not have any more seizures then. Until 13 years later, I started having a cluster of seizures in my sleep. Just wondered if anybody else. Yes, Amy has seizures in their sleep, and somebody said, yes, Amy, yes, exactly. So there are two things here. It is called nocturnal seizures. See, oh my God, let's see, you guys are great. So already learning a lot and knowing very well. So I'm very proud of you guys. Everyone who's watching this channel and then that's a great thing. I love that. So thanks for your participation. So here's the thing. So this type of epilepsy is called nocturnal seizures. Any type of epilepsy can happen during sleep. Frontal lobe epilepsy has more during sleep. So nocturnal seizures, yes, it can happen during wakefulness or sleep. The nocturnal seizures are only during sleep. So if somebody has seizures, the epilepsy starts like this. Usually it happens far away, so every year or every 2 years. And then the network gets stronger and stronger and then matures. And once it does mature, it becomes stronger and seizures become more frequent. So it happens like every week or so on. So it can be this way. It starts far away and then start to become more frequent. Okay, just mind waking up after seizure, low blood sugar, low fatalities. Okay, makes it worse, more likely to happen. Yes. Okay, so hello, hello, doctor. My 17-year-old son has focal onset tonic-clonic seizures, usually in the AM in the morning, struggles to sleep on lamotrigine 200 milligram a day. Is there a link to seizures that morning? Does lamotrigine impact sleep? So two questions. Can seizures happen in the morning? Yes, there are sometimes the stages of from sleep to wakefulness to sleep, this transition can be a vulnerable time for seizures to happen. So yes, it can happen like this way. For example, generalized epilepsy, it wakes up, patients have generalized tonic seizures or jerks in the morning. So this transition from wakefulness to sleep can be the issues with seizures. Can lamotrigine impact sleep? Not a lot, but there are some rare cases when lamotrigine can affect sleep. If it's the case, try to give it a little bit earlier and see if that makes many issues. Can in focal epilepsy, the EEG remains normal, doctor? It can be. So as I said, 15 to 30% maximum maximum 50% of patients will have positive EEG. So the lack of abnormalities on EEG does not rule out the possibility of epilepsy, because sometimes the seizure, the discharge did not happen during the time of EEG. So which means that you're looking out of the window and then no cars cross the street. That time doesn't mean that no cars crossing. It just means that no seizures happen or electricity happened that time. The second thing, it can be deep source, small source. The EEG on the scalp does not see it. Muhammad, hi doctor, great learning, and thank you so much. And this is from LinkedIn. That's great. So we're streaming in multiple locations, and then LinkedIn is one of them. Okay, thank you so much. My son has seizures often around the time of he brushes his teeth. Anyone else have this area? Oh, interesting. So yes, I can say that. So here's the thing. What happened is that this type of epilepsy, it is called reflex epilepsy. Reflex epilepsy is a particular type of epilepsy when there is a sensory stimulation or sometimes just type of normal processing will induce a seizure. I have patients who they have eating reflex epilepsy, which means that every time the patient eats, that triggers the seizures. There are, brushing teeth. I never heard of that, brushing teeth, but I can say definitely it can be. I had patients who have musicogenic epilepsy, music-induced seizures. They hear a one tone, one melody, one artist, they have a seizure. And we have that like very classically in the epilepsy monitoring unit. We play the tone, they'll have a seizure right away. I have a patient with emotional reflex epilepsy. Every time you tell the patient like something emotional, the emotions will kick in and the patient will have a seizure. The reason behind that is that the epilepsy is living in that area where the processing happens. So for example, maybe this child has epilepsy in the area of sensation, where the brushing will activate the area of sensation, or the repetitive movement in the head will activate that area to just do the normal function, and then the epilepsy will be stimulated there. So for example, like if the epilepsy is hiding in one room and you open that room to just do something there in that room or work in that room, then the epilepsy will come out. So that's the reason why this happens. So it's called reflex epilepsy. Hey there, mama to a kiddo with LGS here. So welcome, Risa. Thank you so much for joining us first. It's very difficult to have LGS. So LGS is Lennox-Gastaut syndrome. It's one of the most severe cases of epilepsy. Children often have many seizures a day, different types of seizures. They might have developmental delay. They're prone to lots of injuries and falls. And you can tell me a lot about that. So definitely, it can be an issue, and then moms usually struggle a lot. So thank you so much. Hello, I'm from India. I want to consult with you. What should I do? Excellent. Yeah, you're welcome. Anytime you can do that. So under the description of this video, you can just go to the website, appointment.dromardanoon.com, and you can just book your appointment directly. You don't need anything. You just go there, book your appointment. You choose the time, the date, and do all of that, and we can evaluate the patient via video. So that's very well done. I have done it in the last 2-3 months very, very successfully. I did lots of consultations in India, in Europe, Poland. I did even in like Switzerland, in Arab world, in Middle East. I did in Palestine. I did in many other countries. I did it in Jordan. I did it in Saudi Arabia, Emirates, in other areas of the world. So in Australia, New Zealand, I have done it in many countries. So definitely book your appointment and we'll be able to help you. How to differentiate sleep disorder from epilepsy? Yes, it's very important to do that. So the way to tell the difference is to bring the patient to the epilepsy monitoring unit and then do a recording of the seizures. And then when they have an event, either a seizure or a sleep disorder, and see the brain waves during that time. If it's an epileptic seizure, we will see the changes consistent with epilepsy. If it is parasomnia or sleep-related disorder or psychogenic seizures, then it will not show. Can I do show? Yes, we talked about that. And is Xcopri approved for pediatrics? So Xcopri cenobamate is now given for adults only. However, there are lots of studies being investigated for pediatrics and children. Definitely will be soon given to children, and we have some cases of using it for children off-label, which means that the child is close to more than 12 years old, and it can be done. But it will be soon for pediatrics. Yes. Valproic acid and carbamines interaction. So carbamines is probably carbamazepine. So valproic acid is considered enzyme inhibitor, which means that it will increase the levels of other medications because it will slow the liver processing. Carbamazepine, it is an enzyme inducer. It increases the processing of the blood, so they can interact with each other. It can interact with other areas of the brain. So definitely they can have both side effects on the liver, so they can interact, and you have to always watch the liver. Tennessee, welcome from Tennessee. New now he is getting seizure triggers like pain and other. Yes, definitely this can be. My phenobarbital has changed brands and I'm feeling numbness in my right. Should I be concerned? I'm not sure if it's, like, definitely discuss with your doctor about these specific changes in your body, but things that, sometimes from one brand to another, there will be a little bit different in the concentration. So definitely check the blood levels to make sure that you have enough in the system. I'm 46-year-old and I have drug-resistant epilepsy. Plus, I take drugs called clonazepam, epilim, and Tegretol. Yes, so there are drug-resistant epilepsy. It can happen when you have multiple medications that do not stop the seizures. So we need to do some surgical treatment sometimes, either resective surgery or stimulation devices, as we explained in details in the drug-resistant epilepsy video. So definitely, this is something we can do, and it can be helpful. I have RNS surgery this year. Many talked about it. Said I took at least a year before seeing any changes. Is this experience as well? Yes. So RNS is called responsive neurostimulation device. So this device is implanted inside the brain where the seizure starts, and it reads the brain waves all the time. And once it sees a seizure, it will give a discharge to stop it. Overall, the chances of seizure freedom is between 10 and 20%. And most people will have a significant reduction in their seizures, about 50% reduction or more. And that can be a cumulative effect, which means that it can improve. I have multiple patients with RNS and have mixed results. Some people improved right away when the implantation happens. Some people, we need to go up on the charges and go up on the treatment to have an effect. So there are some different cases. It depends so much on where the seizure starts from and how accurate was the RNS implantation, where the seizures come from. I've been on carbamazepine since 2014, started at 100 milligram and now up to 600. Manage my simple partial seizures. These seizures mainly affect my eye, making it uncontrollable. Yes, so definitely we need to increase the medication with time to make sure that we have enough doses to control the seizures. And then we need to monitor the medication. There are sometimes long-time side effects, like on the liver or on the bones, can cause osteoporosis. So have to be careful with that. If seizures do not improve with this much, it's better to consider other medications or other types of treatment. Okay. I miss my medications or feel lazy. The spread causing my head to move to the left. I want to ask, why do my seizures worsen when I skip my medication? Is carbamazepine still the best option for me? So when somebody skip their medications, yes, that can cause seizures to happen because the medication is covering the body and covering the seizures. And then when you miss a medication, the medication levels will drop, and that can be a vulnerable time. If the medication is right for you, I don't know, because I don't know the case. So we can do a consultation and sit down with you, or you can consider consulting with a neurologist. But I don't know, like, if everyone, what their case. But we can always discuss. I have a drug-resistant epilepsy for 45 years. Yes, unfortunately, epilepsy is a long-term condition. Does Xcopri better than Keppra and for GME and side effects? Well, I have some limited cases. So Xcopri right now is approved for focal epilepsy. It is being studied, and there are some reports to be beneficial in generalized epilepsy. I did use it in generalized epilepsy and was very, very well. There are like about 6-7 medications that are approved for generalized epilepsy. I explained them in details about the GME video. You can review it, but yes, it can be considered for generalized epilepsy. Timberlobe epilepsy, taking valproic, and now clobazam all together. Some auditory auras still. Is it normal? Thanks for the channel. Thank you. Helena says that, if it is, the concept of auras is very important. When somebody has an aura, Aura is a seizure. So that's important. Auras are seizures, but they are small and they are contained. So what happens is that usually seizures will start kind of sparking in the brain and then start to spread to other areas. If the brain and the medications were managing to stop the spread, then you can feel it and does not go all the way to the conscious areas and or memory areas and block it. So you can still feel the aura, but that will be considered a seizure and the medications are not enough or the treatment is not 100% successful, but always comes back to the diagnosis and the type of epilepsy and so on. I want to do surgery. Yes, hopefully, surgery can be helpful, but you need to do it in a center that specializes in epilepsy surgery and they have experience in doing that. I'm from India. I want to consult with you. Yes, definitely welcome to consult. Just go ahead and book your appointment. I'll be happy to see you. Musical triggers, yes. When seizures happen in the area of the hearing, processing of music can trigger the seizures. So it can be. I'm feeling a severe vertigo attack at night associated with aura. Can it be a seizure? Yes, it can be. Like if the seizure is in the balance area or in the brain perception, that can be dizziness and vertigo as a seizure. But usually it's it's short-lived and there are multiple symptoms with it. Okay, I also use an anticonvulsant herb called Brahmi, which I used in India. Now I don't know how to, like these. Yeah, I have patients from India that they use some herbal treatments. I don't know because these herbals do not have strong evidence behind them that they are helpful in epilepsy, and they might have some side effects. So I don't recommend them, at least in my practice. My question is, I haven't had seizures in 1 year, but still have memory issues. Is this something you can do to help me? Yes. So we have a whole video about memory loss and epilepsy. There are multiple issues with memory. First of all, seizures themselves can cause memory loss. Second, it can be the electricity in the brain is too much and cause memory issues, because if it's in the temporal lobe, it can cause issues in memory. Third, it can be side effects to medication. Most common medication cause side effects with memory are topiramate, valproic acid, Depakote, Topamax. These cause lots of side effects on the memory. And at the end can be issues with like anxiety and depression that suppress memories. So definitely get evaluation for all of these. Get a detailed memory analysis called comprehensive neuropsychological evaluation, and that can be helpful to kind of know exactly where things are coming from. I'm from Australia. Welcome, and yeah, happy to help anyone. And we have lots of Australian friends during my training in Mayo Clinic, and then I learned lots of Australian words like the water and all of that. So if I have nocturnal seizures, waking up from the seizure, being consciousness, also have tremors, shaking. Can be BPS, PNAS, psychogenic dissociative? It's hard to tell from just how you're describing them. But what I would recommend, the way to answer this question is to do long-term video EEG. I have a whole series on psychogenic non-epileptic seizures, PNES. Definitely, it's worth reviewing. And the best way to tell the difference is to do a video EEG and then record the event, and that will be it. I have resistant traumatic brain injury, epilepsy for 4 months, seizure-free on 200 milligram. On the first time ever, my seizure started again, now 250 again, seizure-free. Does this mean also cenobamate will not help me? It's hard to tell, like based on a specific case, but it's a good sign that the seizures are stopping with the medication. The way we can tell a medicine it is working, this way, we can say that if the seizures stop for 3 cycles, then the medicine is working. How to know the cycle of epilepsy? Well, so every time between seizures, like the time between 2 seizures is a cycle. For example, if somebody is having a seizure once a month, then their seizure cycle is 1 month. So if you skip 3 months, that means that seizures are controlled. Also take Briviact, can cause psychosis. Yes. Briviact, it does have some side effects on the mood as well, but much less than others. Vertigo attack duration 15 seconds. Yes, might be seizure, might be not. I'm not sure exactly. We need to do a whole evaluation with the patient to know. Which pediatric epilepsy center is best for Lennox-Gastaut syndrome in the United States or internationally? I'm pushing for the 7 Tesla. My kiddo has dropped seizures every 20 seconds to 1 minute, and heard of her. Yes, unfortunately, all the good epilepsy centers there are lots of good epilepsy center in the United States that you can go to. The big names are like Cleveland Clinic, Mayo Clinic, and Boston Children's Hospital, Philadelphia Children's Hospital. All these are good. In the West Side, there are multiple ones. I'm not endorsing anyone. Just all of them are good epilepsy centers. But as long as they are complex epilepsy center, they deal with surgery. Then, unfortunately, the Lennox-Gastaut is beyond our even whatever any center they will still happen. It's a complex condition, and 7 Tesla MRI unlikely that will reveal anything meaningful that will change the management, because Lennox-Gastaut is multifocal all over the brain, so mostly the MRI will be normal. So what is the best treatment for epilepsy again, and why? Well, you can always go back to this video. So but there's no one best treatment for epilepsy. Most of the medication have to be tiered down to the patient's medical history and background. Okay, new to learning abandoned epilepsy after my 23 tonic-clonic seizures from mesial temporal lobe sclerosis. 1 seizure in 6 months. Could you be managed with medications? Yes, if seizures happen during with the mesial temporal sclerosis, try medication management. If the medication do not control the seizures, then we need to do surgery. What happen if lamotrigine and levetiracetam are taken together? They will help each other. So no problem from joining these medications and combining them together. No problem. My daughter is 12 and just being prescribed zonisamide. Should I be worried for bad side effects? Please, her seizures are in her sleep. No, not necessarily. It can be zonisamide overall is a safe medication. We did mention, we have a whole video about zonisamide. I recommend you watch it. It has all the details for things to watch, but no dangerous side effects. Hi, doctor. How will Tegretol, Keppra, and Perambalin worsen generalized epilepsy and trauma? So generalized epilepsy as a diagnosis, Tegretol can worsen generalized epilepsy, but we have to have the criteria for generalized epilepsy, which is like EEG showing discharges all over the brain and so on. So it's very, very important to kind of know exactly is it generalized epilepsy or not. My son was diagnosed with pseudo epilepsy, but he is having seizures, and another doctor focal epilepsy was confused. Yeah, so it's hard to say what type of epilepsy somebody has, or they have seizures or non-epileptic seizures. So the way we tell apart is to do long-term video EEG, record the seizures, and then we know exactly what type of diagnosis we're dealing with. Excellent. So we have lots of other questions that we might not be able to get to. So I will be more than happy to kind of go back and answer more questions and do more of these live streams. If you guys like them, I'll be more than happy to do them more. And so this is important to kind of be in touch. Definitely we can do consultations. And then I have this video about the drug-resistant epilepsy when seizures do not respond. You can watch this video for all the information about drug-resistant epilepsy, how to do epilepsy surgery, and how to stop it. And stay healthy, and see you in the next one.